We're transforming community mental health services in the Black Country. This is our story so far. Our journey began when the Community Mental Health Framework was rolled out across England. Since then, we have been working to transform community mental health services that support people with severe mental illness. In May 2022, 3 services merged to create our Older Adult Therapeutic Service, often referred to as OATS. This service provides therapeutic support across the Black Country. We held an online consultation for our complex emotional needs pathway in June 2022. We launched our In Reach to Care home support service in July. This service was set up to help care home staff manage more complex mental health needs within care homes. In October that year, capacity and demand for mental health practitioners increased. Around 40% of GP appointments now involve mental health. We recruited 16 mental health practitioners and plan to recruit more. We expanded our Admiral Nurse service across the Black Country in November. Admiral Nurses are specialist dementia nurses supported and developed by Dementia UK. In November, we also expanded our rehab service in Walsall so that it can operate in all of our Black Country communities. To support this expansion, we asked the people who use our services to give us feedback to help name the service, and we also recruited staff. We announced our new Community Mental Health Transformation team in January 2023. Areas to develop were confirmed. These include 1. Make it a reality by developing transformed services alongside the services that are already providing excellent care and support. 2. Being creative when designing the best quality care by working with our communities and the voluntary sector. 3. Building the workforce by recruiting, training and developing the workforce. We need to deliver transformed, high-quality services and keep staff engaged with the ability to innovate. 4. Measuring success by identifying what is important to measure and monitor. What are the outcomes we want and how will we know we have achieved them? 5. Focusing on specialist support for complex emotional needs, sometimes referred to as personality disorder, community rehabilitation and eating disorders. In February 2023, we held a face-to-face stakeholder event. We invited people to learn about how we're transforming community mental health services in the Black Country, how they can get involved, and so they can share their ideas and experiences. Due to the popularity of our face-to-face event, we held an online event in March. During this event, we shared our workstream priorities. We also reviewed our workforce needs in March and confirmed how we would utilise existing staff to fulfil our objectives and decide what new roles are needed. Our 3 main work streams were also established in March. These are access, supported intervention and core offer. We looked at who had expressed an interest in being involved and invited them to these meetings. In April, we reviewed our waiting lists. We were aware that people were waiting a long time for support, so we started to analyse the waiting lists to try and combat this. Our workstream launched in May. Meetings started and they involved the people who use our services, the local voluntary sector and other partners from across the Black Country. In May, the support and intervention workstream mapped our NICE guidelines and best practice regarding support and alignment. We confirmed our no wrong door approach in August. This will allow us to work with organisations across the Black Country so that we can work collaboratively to give advice and guidance about mental health support. To stay updated with how we're transforming community mental health services, visit www.blackcountryhealthcare.nhs.uk and search Community Mental Health Transformation today.